Hi, my name is Jessica Romska. This is my head and neck video assessment, and I'm going to start by scanning the room. Okay. All right, so now we're going to set this up. Before we enter the patient room, I'd like to note that I've already checked the chart just to make sure there's nothing that we need to know specific about the patient. All right, let me see. There we go. Okay. All right, so I am entering the room. I am providing privacy, washing my hands. Hi, my name is Jessica. I'm going to be your student nurse today. We're going to perform assessment, okay?
Okay.
Hand hygiene. May I go ahead and check your name or verify your name and date of birth?
Mike Romska, 8/18/77.
All right, very good. Thank you very much. All right, so upon entering the room, I'd like to note that I'm just visually looking at the patient, and I notice that he is sitting erect. His posture is good. He is dressed appropriately for the season. Everything seems to be okay, but we're going to go ahead and continue with the assessment. All right, Mr. Romska, could you tell me what day it is?
It's Monday.
Okay, where are you?
At the doctor's office.
Okay, very good. And how about the year?
It's 2019.
All right, very good. So I'm just assessing the patient's cognition abilities, and I'd like to note that he is alert and oriented ×3. That's using the Glasgow Coma scale. All right, next, I'd like to also say that his thought process is good, his speech is articulate. So far, there are no issues that I could point out. All right, so before we get started, can you tell me, do you have any allergies?
No.
Okay, very good. How about any pain? Are you experiencing any pain?
No.
Okay. So, in fact, if Mr. Romska was feeling pain, I'd ask him to assess that pain scale from 0 to 10, 0 being no pain at all, and 10 being the worst pain he's ever felt. But for this video, he's not experiencing any type of pain. All right, so now I'd like to go ahead and start with the exam. So we're going to start with the head, and then we're just kind of going to work our way down. So I'm going to go ahead and don my gloves. So I'm going to palpate your head, and what I'm looking for, any lumps, bumps. Tell me if you feel any tenderness or anything when I'm touching your head, okay? All right, just making sure. All right, so I don't feel anything that's out of the ordinary or concerning. I'd like to also note that Mr. Romska's hair is very short, so that gives me the opportunity to also be able to assess the skin at the same time. When I'm assessing skin, I'm looking for even temperature throughout. I'm also looking for any type of skin discoloration, irregularities, papules, macules, things like that. I don't notice anything at this time, so everything on that aspect is normal. So now we're going to start assessing the cranial nerve. So we're going to start with the olfactory nerve, and how we're going to assess that is by having you place your finger on one side of your nose at a time, and then blowing out the nostril that's open. Okay, now the other. Very good. So by assessing the olfactory nerve, I'm just checking the patency of the patient's nostrils, making sure that there's nothing obstructing or anything like that. The next nerve that we would assess is optic nerve number 2, but we do not have a Snellen chart for this video, so I would just ask the patient a few questions to assess that. Mr. Romska, do you wear contacts or glasses?
No.
Okay. Have you ever worn them?
Yes.
Okay. How come you don't wear them now?
I had LASIK surgery.
Oh, okay. All right. So, but do you still go to the eye doctor?
Mm-hmm.
How often?
Once a year.
Okay. No problems?
No.
All right. And your vision's pretty good?
Yep.
Without glasses or contacts? Okay. Very good. All right. So, next we're going to assess the other cranial nerves, 3, 4, and 6. We're going to skip 5 and we'll come back to that. But 3, 4, and 6, the way I remember that is they make the eyes do tricks. So we use a finger test for that, or we can use a pen light. And I'm going to use that since you can see it a little better. So what we do is I'm going to place this in the center of the face, closest to the nose, and then I'm going to ask Mr. Romska, would you please follow this with just your eyes only, don't move your head, okay?
Okay.
All right, so here we go. We're going to start. Very good. When I did that exam, I noticed that Mr. Romska appeared normal. There was no issues. When I took the pen light all the way out, his eyes did exactly what I thought they would do. They followed the pen as far as they could, but then they started the jerking movement, which is a normal outcome. All right, so there are no problems with that. So let's go back to cranial nerve number 5. That's called your trigeminal nerve. And the way we test that is by touch sensation. So what we'll do is I'll have you close your eyes. I'm going to touch your face in various spots, and I want you to tell me if it's soft, dull, or sharp, okay?
Okay.
All right, so go ahead and close your eyes for me. All right, so we're going to use the pen light as well, so just let me know what you feel, okay?
Soft. 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 Soft.
Okay.
A little harder. It's dull.
Okay. All right, you can open your eyes. All right, so his trigeminal nerve is working just fine. That is the nerve that tells us if his sensation on his face is working, and it is. All right, so moving on. So far we've done cranial nerve 1 through 6. We're going to go to 7. 7 is the facial nerve, and what it does is it helps the face with expression. So what we'll do is we'll have Mr. Romska perform a few things just to let me know that this is working for him. Okay, so Mr. Romska, what I'd like for you to do is raise your eyebrows for me. Can you kind of look at the camera when we do it that way? Okay, raise your eyebrows. Close your eyes really tight. All right. Can you smile for me? Can you puff your cheeks? All right. Good. Very good. Okay, you can unpuff your cheeks and open your eyes. Thank you. All right. So next we're going to do the, and I murder this word every time, but it's cranial nerve number 8, and it is the vestibulocochlear. I apologize. So the way that we test that is we do a whisper test, okay? So what I'm going to have you do, so we don't have to move the camera around, is I'm going to have you face this way. I'm going to go behind you. I want you to close your eyes. I'm going to go behind you and I'm going to whisper, and I want you to raise the hand on the side that you hear it and also tell me what you heard, okay?
Okay.
All right, so here we go.
Baseball.
Okay?
Kid.
Very good. Very good. Okay, so you can open your eyes and turn back around. All right, you doing okay so far?
Good.
Good. All right, so now we're moving on to cranial nerve number 9, and it's a glossopharyngeal nerve. And the way that we test it is by having you swallow. So I want you to go on ahead, swallow for me. Okay, that looks good. I'm going to note that Mr. Romska had no issues with doing that. I saw the throat move up and I saw the throat move down. I listened and didn't hear any issues with that either. All right, so the next nerve is the vagus nerve. Now the vagus nerve, there's a couple different spots that you can assess this. With vagus nerve number 10, it assesses the throat, the heart, the lungs, and the digestive system. Obviously, we can't open them up and look at that. So what we're going to do is I'm going to assess it by, I want to, just have you breathe. Can you just take a nice deep breath for me? Okay, very good. All right, and then I want to go ahead and just take a peek at your throat real quick, okay? All right, say ah.
Ah.
All right. So by looking inside Mr. Romska's mouth when I was assessing the vagus nerve, I'm also able to make sure that the uvula is retracting whenever he says ah, and that it's midline. So that tells me that there's no issues with the swallowing, speech, breathing, or anything like that. Okay. So the next one, we're almost finished, is the accessory nerve. So what I'm going to do with this is I'm going to put my hands on your shoulders, and I'm going to press down. And I want you to press up against the resistance, almost like you're shrugging your shoulders, okay?
Okay.
All right, so here we go. Shrug. Very good. One more time. All right, very good. So the accessory nerve seems to be working just fine. He was able to press up against my resistance very easily with no issues. All right, so we're at the last one. It's the hypoglossal nerve. I apologize. This one's really easy and it's kind of fun. So what I want you to do is I want you to say a phrase for me, okay? So I want you to say light, tight, dynamite.
Light, tight, dynamite.
All right, very good. Nice job. Okay, so we're almost finished. Next, the next phase of this assessment is for me to check his glands. So there are 10 of them altogether, and I'm going to, there you go. I'm going to have you face that way they can see where we're pointing. Okay, so first we're going to do the preauricle, postauricle, occipital. Okay, and we're going to move down to the superficial cervical. So when I'm doing this one, I'm going to have you bend your head. This is the deep cervical. Okay, same thing. Deep cervical. All right. Tonsillary. That feels good. Okay, and then I'm going to move down here to the supraclavicular. All right, so kind of shrug your shoulders inward for me. All right, very good. Looks good. Okay, so those are the glands. Everything looked fine there. And normally, if you would find anything, you would try to, if you felt anything, it would be a hard lump. And what you're looking for in that case is if it's palpable, if you're able to move it. If you're not, pinch around. If it's hard, that is a problem. We would need to follow up on that. But for this case, everything was fine. There were no issues. I couldn't feel anything, so that's exactly what I was looking for. Okay, so I'm going to also test your ears real quick. So what we're going to do here is I'm just going to, I need you to let me know if there's any sensitivity or anything when I do this. So we're going to push the pin up, pull. Okay. All right, looks good. So I think that's just about it. So we did the cranial nerves, we assessed his cognition, we were able to also palpate the glands to make sure there was nothing there. So that is it. Thank you, Mr. Romska, very much for your cooperation. My name is Jessica Romska. Thank you.